thank you for the kind introduction. I'll follow on the discussion with the next topic. We would like to discuss whether older age is a challenge for fasting in Ramadan. Here we see in front of us the IDF Atlas, the latest in 2021, which shows us the prevalence of diabetes globally, which is showing, as we know, that diabetes is has an age-related increase in prevalence. For those above 65, there's about 1 in 4 individuals who are actually having diabetes. If we look at Malaysia, where I am from, the last national survey for National Health and Mobility Survey in my country in 2023 only managed to analyze the age group above 60 years old, and the prevalence was indeed higher than the global prevalence at almost 40%. So we have an estimated almost 1.4 million diabetic adults in Malaysia of the total of almost 3.6 million. And it is usual that those who are older are screened, and therefore there are more diagnosed diabetics among the older individuals, as we can see in Malaysia. Among that 1.3 million, 77%, 3 out of 4 are diagnosed, and therefore they are getting treatment and screened for complications and comorbidities. About 1 in 4 are not diagnosed. There are specific concerns in the elderly with diabetes, and this would also implicate similar concerns when they are fasting during Ramadan. Diabetics who are older may, of course, have longer duration of diabetes. Of course, this depends when the onset of diabetes is, and we do understand that diabetes is occurring at younger onsets, especially in my part of the world, in Asia. There are then higher rates of comorbidities, as we know, in older persons with diabetes, hypertension, dyslipidemia, and also obesity, but also the other extreme, what you call sarcopenia, which also increases insulin resistance and associated with its fair degree of complications. There are higher rates of diabetes-related complications, microvascular and macrovascular, but in particular of concern is arteriosclerotic cardiovascular disease, such as strokes and myocardial infarcts, as well as chronic kidney disease. We do feel that there's poorer control of diabetes, not only diabetes, maybe hypertension and dyslipidemia as well among the elderly, in view of their difficulty in adhering with many medications to take. As I mentioned here, higher burden of medications. Particularly concern, as we see, is that there are higher rates of insulin use in this vulnerable group of people who are indeed at risk of hypoglycemia. And in fact, we sometimes think setting less tighter targets to make it safer and actually improve their quality of life. The higher risk of hypoglycemia, particularly the ability to pick up the symptoms of hypoglycemia or actually hypo-unawareness, we know is much higher in the elderly, and hyperglycemia as well, and what we know as glycemic variability. And we are, of course, particularly concerned about neurocognitive dysfunction, dementia, frailty as well. So the considerations for the elderly seeking to fast, of course, this is quite a general sort of fact that they having comorbidities and complications, we have to particularly ensure safety during fasting in Ramadan, and therefore a particular focus on how they actually adjust their physical activity patterns to ensure their glucose is in a safe region. The ability to manage their glucose and measure and monitor is particularly important and should be enhanced. Their medications need to be adjusted and possibly avoid those that enhance hypoglycemia occurrence. Feeding patterns and general independence are other factors to take into consideration. We did report previously the initial results from the DAR 2020 Global Survey back in 2021. And here we already noted there are some important concerns in the elderly, where we found that there are higher rates of hypoglycemia as well as hyperglycemia in those who are older. The sub-analysis in this publication was that comparing those below the age of 65 and above the age of 65. And it was concluded that in those above 65, 1 out of 5 also needed acute hospital care during Ramadan. Yeah, and these are the other sort of important findings that we reported for the initial DAR Global Survey 2020. As you can see highlighted in red, that a particular rate of hypoglycemia among the older individuals, much higher, twice of that below 65, 12% versus 6% for hypoglycemia requiring a hospital sort of attention, and hyperglycemia rates were almost similar regardless of the age group. So we are also following that. We had the DAR, sort of IDF DAR guidelines, where we first introduced the risk calculator and how to score risk. And here, as I pointed out in the red arrow, among the elements that were considered to assess risk, age above 70 years old. This is the only time that a particular age group is actually highlighted in the whole risk scoring, was actually given a high score of 3.5. So if someone was above 70 years, he would already score 3.5, and that would already put him in a moderate risk. And because this age group often have the accompaniment of other risk elements here, certainly this age group would usually score in the high risk, and therefore easily you can see recommendation for high risk would be to avoid fasting. However, we know that many individuals in the older age group are able to fast safely in Ramadan. So we were fortunate to actually repeat the DAR Global Survey in an extended number of countries and had many more individuals. The initial DAR survey was almost 6,000 individuals, and the subsequent DAR survey in 2022 recruited almost 7,000 individuals. So the combined total population was a good number of 12,500 plus individuals in the combined survey. And here I put to you the number that was above 65 years, which we managed to sub-analyze, was about 22%. A bit more than 1 out of 5 individuals in the whole combined survey were those above 65. And you can also appreciate here a sub-analysis of this category of 65 to 75 of about 2,361, and above 75 of a little bit more than 400. And within those bigger categories, they were sub-analyzed into the duration of disease, as you can see, because that would matter. It's not just about age, it's also about how long you've had diabetes, whether it's below 10 years, 10 to just below 20 years, and above 20 years. And we would expect a heavier degree of comorbidities, complications, and as we know, other consequences as diabetes duration actually increases along with increased age group. Here, I would like to present the rates of fasting among the older individuals. Here you can see nicely subcategorized for the duration of disease as well as the different age groups mentioned. And we can appreciate that with increasing duration of disease and higher age above 75, you can see a drop in the rates of fasting in Ramadan, and this is quite expected. But for those in the 65 to 75 age group, they are consistently about 3/4 of them fasting. The older age, in fact, had better A1C. We were thinking that maybe they could not cope with the disease and we would relent to actually having less tighter targets. But as you can see here in the orange, in all the different duration of disease, those with older or 75 and above had a lower, marginally lower A1C than the sort of slightly younger, older adult fasting in Ramadan. The older age group had lower BMI. Yeah, and we know that as age goes, BMI can lower, and we particularly worry about what we call sarcopenia. So we do approach, especially those with longer duration of diabetes above 20 years, as well as above 75 years, about 20, the BMI is actually about 24.9 compared to the others, yeah? And how about the comorbidities of hypertension, and dyslipidemia. So you can see here not much difference in blood pressure and lipids, yeah, LDL particularly, yeah, in this age group who had elevated lipids and BP, systolic was there. And diabetic complications and comorbidities in the elderly, I guess you would appreciate that the older individual would have higher comorbidity rates, as you see both in the 65 age group and the more than 75 age group. They would have higher rates of hypertension, dyslipidemia, and the increasing rates of retinopathy, neuropathy. But you can see numerically that once you are above 75 compared to those below 65 to 75, the rates are slightly lower. Yeah. All right. So next comes glucose-lowering medications, which are very important because of particular concern is the medications that predispose to hypoglycemia, which are sulfonyl, ureas, and insulin. So here you can see immediately, if we focus on the most extreme on right side of you for both the age groups, that the rates of insulin are particularly high in those who are older. Yeah, 70% of those above 65 are on insulin, and that can really predispose to hypoglycemia. And you can see the SU rates are a bit lower as they are getting older. But rates of SGLT2 inhibitor, of concern GLP-1, maybe there's a concern about using these drugs in the older age group. The incidence of hypoglycemia is higher regardless of the lower older age group or above 75, as you can see an increment of about 21 to 22% of hypoglycemia. That's very high. And the need to actually visit hospitals, either the emergency department or get hospitalized for hypoglycemia is presented to you here. Yeah, so you can see certainly once you are above 75, that is a big jump in the rates of actually requiring acute hospital care because of hypoglycemia. How about the other extreme, hyperglycemia? So hyperglycemia, as you can see, a mixed pattern here, that there is higher rates in those below 10 years if they are older, and actually above 20 years if they are older as well. Yeah. And how about their need to actually visit hospitals due to hyperglycemia? So again, we can see a definite sort of difference between those in the 65 to 75 year age group and the 75 above age group. And they are actually requiring more sort of need to attend hospitals for hyperglycemia, and also having more frequent hyperglycemia. Yeah, and those above 20 years old, 20 years of diabetes, almost half of them are having frequent hyperglycemia during the month of Ramadan. So, ladies and gentlemen, I think I've presented to you some of the findings of the combined group of the DA 2020 and DA 2022, looking at the age group sub-analyzed above 65 for those 65 to 75 and more than 75 years old, and also sub-analyzing further to different duration of disease. And we do see some association there, where the older they are, above 75, and the longer duration of disease, they are actually, sort of confronted with more sort of concerns of complications of both hypo and hyperglycemia, particularly that which is of concern in terms of severity as well as frequency. So in summary, we know also from the beginning that this large cohort of more than 12,000 individuals did show what we would seem, what we would understand, that there would be lower proportions of elderly individuals fasting compared to their younger counterparts. But maybe this is a concern. Should there even be lower than what we see? As we can see there, up to 60% are still fasting. Diabetes-related complications, as mentioned, hypo and hyperglycemia is more frequent as expected in the elderly, than the younger sort of elderly, and therefore we should have greater and more careful planning in the pre-Ramadan in this age group, in the elderly individuals, to ensure a safe fast during Ramadan can be achieved. There should be greater emphasis on Ramadan-focused patient education and self-monitoring of blood glucose in the elderly individuals. during Ramadan fasting to ensure safety. And we should be particularly concerned now that there are more options. Thank you very much for listening.